Well, good evening to everyone, and thank you for joining us in this session. My name is Michelle Fletcher, and I am the college recruiter for CVCC. Just an FYI before we get started, this session will be recorded and it will be uploaded to our website and our YouTube channel. And I would encourage you, of course, after this session, to go out and take a look at previous sessions that we've already recorded and then future sessions that we will record going forward. It is our effort to make sure that you have the information that you need as you make an informed decision about CVCC. And so with that said, our guest speaker tonight is Ms. Susan Fitzsimmons, CVCC's Associate Professor of Professional and Career Studies, and she is the coordinator, I think I have that right, of the Radiology Department. And if I'm wrong, she'll correct that. Ms. Fitzsimmons will be discussing with us the CVCC's radiologic program and probably some of the career paths that you can take with this particular credential once you have graduated from CVCC. Listen, feel free to ask us questions along the way. We want to make sure we entertain your questions. If you don't want to ask out loud, put them in the chat. I will be observing the chat. And we'll make sure that you get those questions answered. We will also leave a few minutes for Q&A. So when Ms. Fitzsimmons is done, we're going to open it up for Q&A. And if you have any questions, please write them down and be prepared to share them with us if you should desire at the end of the session. So with that said, I'm going to go ahead and give it over to Ms. Fitzsimmons, and she's going to take it from there. Susan?
All right. Thank you, Michelle. Hello, everybody. My name is Susan Fitzsimmons, and I am the Radiography Program Director for CVCC's Program of Radiologic Technology. Most of what I'm going to tell you, you can find on our website. I know some students have a difficult time in finding information about our program. If you go to the CVCC website and you go under programs, look under healthcare, you'll find radiologic technology towards the bottom. And we have a lot of information about the program. And of importance, you will find our student handbook, which gives all the rules and regulations, our expectations of students, and the information that we give all of our students. And so that's published there for you as well. Now, for the Radiologic Technology program, we are a very intensive 6-semester program. That means we go fall, spring, and summer sessions for 2 years. At the end of those 2 years, graduates will earn an Associate in Applied Science degree in Radiologic Technology, and they will be sitting to take their national board exam through the ARRT. In order to work in radiologic technology, you must sit for your board exam and pass that board exam. Now, our program contains 2 main components. We have a clinical education component, and we have a didactic instruction or classroom component. The clinical education component is there to prepare students to go to work. This is your work experience. This is an occupational program, and the whole purpose of this program is to train you to be a radiographer. So clinical will be held we have 6 clinical sites, all are Centra: Lynchburg General Hospital, Virginia Baptist Hospital, Bedford Memorial, Southside Community in Farmville, Gretna Medical Center, and Central Virginia Imaging. All students go to all clinical sites. Our program alternates class and clinical. So as a freshman, Monday, Wednesday, Friday, you're in the classroom, and Tuesdays, Thursdays, you're in clinical. As a sophomore student, that switches. You go Monday, Wednesday, Friday to clinical, and Tuesday and Thursday in the classroom. As far as hours go, this is considered to be a full-time 40-hour-a-week program. There are no fast track options for students. So even if you have completed all the general studies requirements, this is still going to be a 6-semester program. Our students will complete over 1,800 clinical hours in preparation for entering the workforce. Now, our didactic component, or the classroom component, is preparing you to take that national board exam. The didactic component requires our students to have good study skills and the ability to think critically. All courses are sequenced. Some may have prerequisites. Again, there's no fast track option for the program. It is a science-based curriculum. We do have an associate's in applied science. So not only is it a science-based curriculum, it's the application of what you have learned clinically in the field from what you take from the classroom. Now, students can be expected to be on campus or in the clinical facilities 5 days a week each semester. We do have some evening shift requirements as well as weekend requirements starting in the 3rd semester. Now, as far as the clinical component, the clinical education prepares you by teaching you real world applications. You are working with real patients in theoretical principles of radiography, patient care, the procedural aspect, radiation protection, and of course, practical experience in doing patients. Students will have the status of learners, and you will never replace members of affiliated staff at the hospitals, but you will be working along side by side and doing patients. Radiography requires not only good study habits, but it requires a student to be self-motivated, someone who can think critically, someone who's willing to jump in and do. Our program is very much hands-on, very patient care oriented, very patient-centered. Now, what else about our program? We have a very different grading scale than many other courses in the college. For our didactic portion, we have a 7-point grading scale. Anything below a 75 for us is an F. Any student who fails a course is out of the program. There is no opportunity for students to continue in the program. Clinical education is a 5-point grading scale. Anything below an 85 is an F. Now, why do we have the grading scales? Most healthcare programs require their clinical component to be a 5-point scale. You are working with real patients, and so the expectation is that you will be doing the best of your abilities. For classroom, the passing grade on the board exam is a 75. So therefore, we cannot allow students to make anything less than a 75 and think that they are going to be able to pass a board exam. So that's kind of our grading scale that is going to be a bit different. Now, also in the program, we're not only preparing you by teaching you how to do the procedures, we're not necessarily only preparing you for the board exam, but we're preparing you for work experience, learning how to navigate the medical field, learning the patient care aspect, learning the communication aspect, learning good, professional, appropriate work habits, and medical knowledge as well. So it's a well-rounded program that is going to teach a lot. It's very fast-paced. It's very heavily anatomy-based as well. Students have to have good study habits in order to keep up with all the knowledge they'll be given. You have to be X-raying patients by week 8 in the very first semester. So again, it moves very, very quickly. Now, what else can you find? As far as what do you want to do if you want to be admitted to our program? For admissions to our program, we have a selective admission, which means we only have room for about 15 people. And that is required by our accreditors, the JRC-ERT, who is the only U.S. Department of Education recognized accreditors for radiography programs. So entrance into my program is a very multi-step competitive program or competitive process. So what do you do first? You have to meet with a counselor. Students desiring to enter the radiologic technology program should meet with a counselor to talk about the referral process. So you would need to provide copies of your high school transcripts, all college transcripts. Applicants for referral must have 2 years of a lab science, and this can be in high school, such as chemistry, biology, or physics, and 2 years of mathematics, like algebra 1 and 2 and/or geometry. Students must also have completed Biology 141 within the past 5 years, or they may be currently enrolled in Biology 141 during the spring semester in which they are going to make their application. Students must have a C or better in Anatomy and Physiology, which is Bio 141, in order to be considered. So what happens? You go, you have your anatomy, you have your transcripts, you go to a counselor. The next thing they're going to do is they're going to look at your GPA. My minimum GPA requirement for college is a 2.9. Anything below a 2.9, you cannot be referred to the program. So let's say you have a 2.9, you have your anatomy, you're good to go, a referral is made. So once a referral is made to me, you are going to be given information from the counselors about shadowing. Next year, all students are going to be required to shadow in diagnostic radiography at a local hospital for a minimum of 8 hours. 8 to 16 is recommended. Right now, it is strongly encouraged, but it is going to go to mandatory. Candidates have to be able to discuss the shadowing experience while they are at the interview with me. So I get a referral. What's going to happen next? What will happen next is I'm going to send you by email an application, a letter to read, which will give you information about going on the website. I will link you to my program's website and also our student handbook. I will have you look at the handbook, look at the website, look at some of the factors that are consideration for what skills you need to be able to do the job, such as ability to hear, speak English, good visual acuity, mechanical skills. So things that I will give you to look at to make the determination if you can meet the eligibility. So send you the application. I give you 14 days to respond to me with a completed application. Once that is returned to me, you will be given an interview time in which you will meet with me in the office, and I will ask you a series of questions as well as score you on the interview process. We have an acceptance committee. I would be the only person who ever sees you, and I score you solely on the interview. There is another person in the program who will see only your application and transcripts, and they will score you on factors based upon your application and transcripts. Then there's a third member who will take what I've written and what the other person has written, review those. We will sit down and discuss. Everybody is given a numeric score. The top 15 candidates will get in. So it's an extensive process. I usually am interviewing 50 people, and that is for 15 positions. So it is, as far as the selection process goes, it does take a great time to sit and go through everything. Students are notified the second week of May. As soon as grades are posted for spring semester, they will be notified of their status. Either they were accepted. There may be a couple candidates who are offered alternate positions, and an alternate position means if one of the 15 candidates who get in cannot get in or decides they don't want to get in, then I will call an alternate candidate who can then instead take their place. Otherwise, alternate candidates can reapply the next year, and normally we will accept them. Most people receive a non-acceptance letter. And if they come back the next year and improve their application, they will be given points towards the application process. But we have no wait list, and we cannot guarantee acceptance to anybody. So that's kind of the selection process. That's a little bit about our program. Students always ask me what makes a successful candidate. And a successful candidate is going to be somebody who is very self-motivated, who knows what this field is about, and who is willing to put in the time and effort in their studies and in their clinical time to be successful. It is someone who is not afraid of test taking. We do multiple test taking every semester in the didactic component, including comprehensive final exams. Your clinical grades are primarily through someone grading you while they are watching you do patients. So you are being tested all the time. So somebody who has test anxiety, you may want to find ways to resolve that before you apply to the program. What else makes a successful candidate? Again, someone who's self-motivated, someone who has good study habits, someone who has good critical thinking skills, and somebody who's willing to put in the time and effort to do this, as well as somebody who is compassionate. The majority of what we do is patient care. And so you have to be willing to want to work with patients, and that means moving and lifting, maybe helping to dress and undress, moving, transporting patients to and from a vehicle in a wheelchair, any number of patient care options that you may have to do. People come in, they want the technology. Well, that's fine. We do take x-rays, but again, this is a patient-centered field, and the majority of what we do revolves around the patient. Now, what can you do after the program? So you get through the 2 years of the program, you sit for your national board exam and you pass. Our pass rate is 100% for the past 3 years, and for the past 5 years, we're sitting at 98% on first attempts. If students listen and do what we tell them to do, you will pass your board exam. We have 100% job placement rate for as many years as I can remember, and I've been with the program for over 20 years. So what can students do? They can be in general radiography. They can work in a doctor's office. They can work at an imaging center. They can work at the orthopedic office. They can work at any of the doctor's offices like the CMGs or family care centers that have x-ray, or they can work at the hospital. We have a job fair every March where the local employers will come and try to recruit our students. Some of them will take students right out of our program into cardiac cath lab, into interventional radiography. Some of our students choose to go straight into CT or MRI. I think we have had several recently go into mammography, and one of our recent graduates was just given an opportunity to learn breast sonography. She's only the second student out of our program to ever be given that opportunity to learn breast sonography. So that's a big thing to have her be able to step into that as well. So there are many, many options. You don't have to go back to school for CT or CT or mammography or cardiac cath. Hospitals are in need of people, and they're willing to train you on the job. You do have to sit for another board exam, so you will have to get some continuing education, but that can be done on your own time. The hospital will train you while you are being paid to learn that new modality. We have students who are everywhere. We have students in Roanoke. We have students who are in management at the hospitals and imaging facilities. We have students who are in Charlottesville. We have students who are in Richmond. We have students who are at Duke and at Wake Forest as well. So the opportunity is there for everyone. If you graduate from this program, we have a really good name, and our students get hired. So as far as that being my spiel, that's pretty much what I have. So Michelle, if anybody has any questions, I'd be happy to answer, but I think that's pretty much everything that I can give them. And again, you can go on to our website for CVCC, go to programs, healthcare, find radiologic technology, and you can find all of our information in our handbook there.
Okay, thank you, Susan, for a very clear and a very thorough layout of the radiologic program. That was fantastic. So we're going to take a few minutes because we have a few that we can open up for Q&A. So I would do just that and ask anyone on the call, if you have any questions, please, right now is the time to speak with Ms. Fitzsimmons about it. And again, you're speaking with the boss now, so this is your turn to ask the questions that you need to ask. So let's go. We'll open it up. Any questions? You can put them in the chat if you like. No questions? And I'm not going to be surprised at that because Susan did a great job laying this out. Let's see. I see something said I missed the first half of the presentation. Is there any way you, yes, let me say already so you'll know, we will upload the sessions to our YouTube channel. So you have every opportunity to go back and sit and listen from the beginning, everything that has been shared this evening. And I would encourage you to do so because she packed a lot into the last 30 minutes. And so I would encourage you to definitely go out and take a look. You're welcome. Yes. Any other questions? All right. Well, I have just a few gentle reminders, and then I'm going to move us on and close out the session. If you would, just mark your calendar because Tuesday, March the 5th, will be our next information session, and we will be highlighting CBCC EMS program. So if you are interested or you know someone that's interested in the EMS program, please mark your calendar for March the 5th, which is a Tuesday, from 6 to 6:30. We will be hosting our next information session. Again, these sessions are on our website, ones that we've already presented on. I would ask you to go out, take a look, because again, a lot of good information packed in 30 minutes. The videos are out there on the YouTube channel, so when you get, take a look. Susan, do you have anything that you'd like to share before we close out?
Actually, Michelle, I did think of something that I forgot to say. We do take referrals only until March 1st. So we do have a set deadline. We can't take referrals beyond that. So once it gets to February 29th this year, I cannot take referrals beyond that date. Okay, so we begin referrals in January and we stop at the end of February, and that's usually all that we can take. Again, we can only take those 15 students.
Okay, very good. All right, well, we're gonna go ahead and bring this call to a close. Thank you again, Susan, a great job. And I would ask that those on the call join us in a future session and have a good evening. Thank you.
Thank you. Bye-bye.
Bye-bye.